Aga from Sweden, Patricia Hadley from Australia, and Dr. Ramisamy Sudasana from Chennai in India. And we will talk about homeopathy and children, treatment in childhood. And we have a very rare thing here because Elizabeth in Sweden has a lot of problems because there it is not allowed to treat children up to the age of 8 with natural and homeopathic medicine. Can you imagine?
The only country in the world, I found out. Initially, when I moved to Sweden, I am Swedish, but I lived in London for a long time. But when I moved back, I joined an organization and they thought it was North Korea, Cuba, and Sweden, only 3 countries. But I rang the embassies and it's only Sweden.
So interesting. What was the main cause for that law?
Apparently, so it started in the 60s, I think, or it was legislated in the 60s when, because children at that point only had contact basically with their parents and people around them before going to school. And in Sweden, you didn't go to school until age 7. So this was to protect children in case parents didn't take their, children to the doctors if they were ill. But if that is the reason, and that's what we found out is the reason, is the legislation is obsolete because in Sweden, 98% of children goes to childcare, government childcare from the age of 1. So it's pointless, really, if that is the reason. But I think there are other reasons.
Yeah. So what do you think? What reasons are there nowadays? To keep that law alive?
Yeah, well, I think there are. I don't want to go into any, but I think Sweden is a very sort of scientifically based country, and anything that is not scientific is deemed as pointless. It's not working. You can't prove it works, even though there are lots of studies that, for instance, homeopathy or acupuncture is actually now available in the national health. But I think that is one of the main reasons that the very strong scientific beliefs in Sweden.
Our colleague in India has a lot of better opportunities because they have the Ministry of Ayush that protects them really. And in India, homeopathy is much more science-based, isn't it?
Yes, definitely. It's the Ministry of Ayush. It takes a major role in protecting the systems of treatment native to India, Ayurveda, Siddha, as well as homeopathy. And it has definitely done a lot in projecting this native systems as well as homeopathy, role of homeopathy, even in the pandemic situation. And they have put forth suggested the ministry by itself and the central government has advised the general public to consume homeopathic medicines, Ayurveda, as well as Siddha medicines to restore their immunity or to build up their immunity in view of this pandemic. And that is highly advantageous and very supportive. I should be really thankful to the government for this major initiative in promoting this Ayush at this juncture. And that's it. That it keeps going like it's both all streams of the Ministry of Ayush, that is Ayurveda Yoga. That yoga has an international yoga day. It's being yoga is being popularized all over the world. So India takes every system apart from the conventional allopathic system of medicine. This currently the scenario is that more importance is being given to these lines of treatment, and we have a better choice. We have a better option right now, and we are not, though we are not allowed to treat active cases of COVID, we are in the preventive stage, it has been advised by the government to take on homeopathy.
What a different situation.
Hmm.
You're so glad.
Dream situation.
Yeah.
A dream situation.
A dream situation. When we are thinking of our countries, having something like the Ministry of Ayush is a big dream. Especially in Australia. I heard from Isaac, you have a lot of problems down there at the moment.
Yes and no. I mean, I see a lot of pregnant women and newborn babies. I mean, in Australia, parents actually have the right to choose who they go and see. It's a bit of a buyer beware situation. Even people who really are not properly trained can put up a shingle. And if people are silly enough to go and pay their money and be treated, you know, it can happen. And unless, you know, a complaint is brought against them, you know, they will prevail. So I do see a lot of newborns and very small children because I'm a lactation consultant as well as a homeopath. And it was really good here that people would get recompense, you know, in private health. But that's been removed by the government a couple of years ago because of that NHMRC, you know, investigation. Bit of a kangaroo court, really. So things are in abeyance at the moment. We've had a complaint before the Ombudsman, which is in the last stages of being resolved. We should hear soon. Hopefully, I'm sure it'll be in our favour because, you know, it can be no other way. Probably the next election, they'll try and buy favour with the populace again, and they'll offer rebates and private health again, so it should come back. But of course, in the meantime, we don't have any colleges open for homeopathy because there's no interest. And that's a problem. And so then the profession suffers because we don't have new students, new graduates coming through to support the professional bodies. And of course, the people who are in the professional bodies are like me, old. So that's a worry. So we'll see what the next few years brings.
Yes, and again, India is in the best situation here. Where we have so many colleges and so many extraordinary people and young people, young practitioners coming on.
Yeah. Actually, I must say I was very fortunate in the college I went to in Brisbane that the lady who headed up our college was a BHMS from India. And so, you know, we were pretty much taught the Indian model, which was good. It was a very thorough training. So I'm quite blessed that that happened, really. And we had a lot of teachers who were all clinicians. But of course, now it's all online and streamed, and, you know, the information is quite minimal and basic, and it's not good. You know, it is a master-apprentice situation, but becoming a homeopath. That's why we have a lot of master teachers and we have something to learn from each other. And that's always the way it's been and should continue. And it should be like that in the teaching, which is more the model, of course, they have in England, which is good.
Elizabeth, how was your training in England?
It was very good. I actually started training when I lived in Australia in 1998, I think it was. At the Nature Care College in Sydney. But that was quite interesting because homeopathy wasn't a big thing there. The training, I would say, wasn't great there. But,
no, it's more a naturopathic college, Nature
exactly,
Care.
Yeah.
Yes. I mean, Brisbane was actually the centre of excellence for homeopathy in Australia because we had the Indian influence, but Nature Care was a naturopathic college and homeopathy was only an aspect of that. So a lot of the homeopaths in Sydney, you know, have good grounding in the naturopathic kind of approach, but it's not totally classical.
No. And then I actually first started training at the College of Practical Homeopathy, which is not classical, but it was I think the one thing that was really good, that they were very good at getting practitioners out and being confident in treatment. So there was a large element of it was classical homeopathy, but there was also other methods that we learned. And then I went on to do the I've studied with Jeremy Sharp.
Dynamis,
It's Dynamis, which has been excellent for me, very good for me, and actually simplified things a lot compared to this. It's actually quite difficult when you have a lot of different options and different methods and you can do all these kind of things. So for me, that's actually simplified things, I think.
Mm-hmm.
I'm not saying
of course, once you start working, you find your own method, and you know,
exactly.
Yeah.
So I think I've had very good training, I think, very broad training. And then obviously I've done other things. I'd love to go to India, but I haven't been able to do that. One day.
We've had a lot of Indians come to Australia to teach, so we've been quite blessed. You know, we've had Rajan here a few times, and Farouk Master, and the Joshis, and Dinesh John. I mean, just about all of the ones who are recognised have come here because we're quite close, and it's easy to come to Australia.
And in Sweden, we have a few colleges in Sweden. I haven't actually been to any of them, but I think the problem here is that most literature is in English, and I actually thought when I moved to Sweden, I thought, everybody in Sweden speaks English, but everybody in Sweden speaks English to a level where you can sort of make yourself understood. But then the books that we read are quite old-fashioned and words that nobody uses. So I think it's sadly a bit limited. I have been asked to translate some of these books, but I'm not doing that.
Maybe when you are retired, you can venture.
No, I don't. I actually work with some translation and text, word processing, scientific text, and I don't actually like translating, so I'm not going to do it.
Yeah, understand. So we have here 3 practitioners who are very good in pediatrics and have a lot of experience. Obviously, Elizabeth had the experience more in other countries than in Sweden, because in Sweden she is not allowed to treat the little ones. I just had here a cat, and what we vets find very similar in people who do pediatrics is that we have to deal with clients who do not really talk too much. And we have to rely on symptoms. And so I wanted to ask you how you do it. How do you do the prescribing and the observation of the client you have? What is your traditional way in each of the countries to approach the little ones?
In my clinic, I've got it set up so that there are lots of things for children to play with. So I like them to come in and make themselves at home, and it's a lot of observation and seeing what they do. I often get them to draw something for me, see whether they will engage with me. There's a lot you have to pick up about what's not being said. Also, too, I think it's important to try and get information from the child rather than the mother. She'll often filter things, and I sometimes find it's better to actually ask the child if they're verbal, what it is that they really like to eat. Mother will be telling you it'll be whatever's good for them. It is a little bit different. But observation is really, really important.
I do agree with Patricia that observation is the utmost a way of visualizing the symptoms or taking on to the picture of a child. And as she said, I would catch up on that child they enter my consultation room. So how they sit, whether they cling to their mother, or whether they are appreciably near me. So many of the children, you will find differences in how the child reacts to a physician. Some of them will become very close to your chair, to trying to touch whatever is on the clinician's table. They will be trying to take hold of the step or to the pen or the notebook or whatever we have. And some of them they'll be sitting back, they'll not be very what is that? Not reactive to whatever we speak. So this is an initial way of me assessing whether the child is very receptive to strangers, or whether how the child is very social and something like that. It begins like that. And what are the objects of their preference? As you said, what they pick up, whether they're able to draw, and if given a pen on hand, what will be their first object to be drawn? Whether it is a flower, it's a cat. As you have a cat on your lap, you prefer animals. So you have a passion for animals. Likewise, the child's desire, it could be the first outpour how they take on the objects. Only the objects which they desire, they'll be taking on to it easily. So the assessment or happens like that. Which, how do they enter? How do they immediately react to the persons around them, either the physician or to the attender? Then comes the questioning part. And first and foremost, it is non-verbal communication or non-verbal observation is the most important part of taking on a case of a child.
I often find with a baby, just something simple like having the mother change the nappy while they're there. You know, you can see the stool, see the skin if it's mottled, you know, just little subtle things. You know, you think, okay, maybe that's Nux vomica I need to consider, you know, it's, you know, you've really got to be observant.
We have the rash around the cheeks, you know, that the baby who feeds milk, if it drools out, and if they're allergic to milk, they will develop rashes out here and the cheek area out here. So this is what we observe, not only how the child reacts or something like that. This for a grown-up child about 2 years or something like that, we can observe how do they, whether they reserve, whether they are very practical in dealing with other strangers. But as an infant or a neonate for that matter, what we see on the skin, what we see on what is their feeding habit, everything, how is their sleep, we have to inquire all from the mother. So who takes care of the child? Immediately who takes care of the child? That is, from that person we'll be getting the information.
One other thing too I have found in clinical practice with the little babies is that sometimes the baby's picture or constitution will complement the mother's. So if you've got a sepia mother, quite often you'll have a nat carb child. You know, if it's a pulsatilla mother, you know, you might have a belladonna stramonium calcarb little one. So, you know, these are the kinds of connections that you can, it's quite amazing how it will pop up.
It's all a big energy system, the whole family. What's your experience in that, Elizabeth?
Well, quite similar actually to the other two here. Obviously now, since I've been in Sweden for 12 years, I haven't actually treated that many young, small babies, so, or up to 8, or none really. But in London, where I was practicing, quite often the midwives sent the mothers down to us from the hospital and said, you know, go and get some arnica for the birth. And then they would actually then come back with their babies. And like, you know, it is all observation, and, you know, obviously you have to speak to the parents as well, but it's very much checking how the child or baby interacts in general. And now I find with, I do treat quite a lot of children, but above 8. And I work mostly, well, I've always worked mostly online for various reasons. And but I find the children who are obviously older, that they're quite comfortable talking, much more comfortable talking online than they are when they're coming into the clinic. They open up much quicker, which is good for me, but worrying that for me, what I worry about is how they can open up to other people that might not be suitable to open up to. But I'm finding that's my observation, that they, and also quite often the mother will, or the parent that comes, usually the parent that comes with them, doesn't, leaves the child to talk more when online, actually. I think that's my main observation with the difference with the online and seeing in clinic.
I have a couple of chairs opposite my desk, and, you know, if it's the child's in the spotlight of a mother's brought in a couple of children, when it's your turn, you're in the chair that's in front of me, so we engage. Then they quite like that, to be the centre of attention. Older siblings will often comment and give you information that, you know, is maybe missing, which is always interesting. Got to be alert for everything.
Yeah, it's important to hear from lots of different people sometimes, isn't it? Especially for the ones that don't talk.
Yes. But I'm in Australia. I don't know what it's like in India or in Europe, but I mean, the babies, of course, are given vitamin K at birth and Hep B before they leave hospital. The mothers are given vaccines in the 3rd trimester. So sometimes those very early pictures, you know, liver congestion. I use a lot of Nux vomica with newborn babies, just getting them through the birth and clearing out that liver. And so, of course, you know, the 6 weeks they have the next lot of shots. So it gives me an opportunity to engage them about the process of, you know, where you're going to go with the vaccine schedule, and maybe have a conversation about homeopathic prophylaxis, which people are quite appreciative of. So you can give them lots of information to begin researching it, you know, starting to look and make decisions about what they think's best for Bubby. And I'll bring that up if I really see that the picture that the newborn is there, you know, they just really haven't coped well with those original shots, and that's a bit of a worry going forward if they have more and more and more, if they're not resilient. I mean, on that question of resilience, I mean, there's so much technology now around the whole reproductive process. You know, we've got IVF, we've got elective cesareans, we've got artificial oxytocin used in labour. Not all mothers are breastfeeding. So it's, you know, it's physiologic conception, birth, nurture, which primes the oxytocin receptors. And so if oxytocin receptors are not primed optimally, you know, resilience is low. And those babies aren't so robust. They're not going to handle, you know, intransigences so well. I mean, I'm in an opinion now where you know, where Hahnemann named 3 miasms, and I know it's a theory, and, you know, we have lots of people have lots of perspectives, but I find it interesting that he only named 3 miasms. And I'm at a point now where I think that it's because we've got 3 metabolic pathways. You know, we've got homeostasis and we've got anabolism and catabolism, and SORA is the miasm of homeostasis, and it's underpinned, I'm pretty sure, by oxytocin, which is a natural antagonist to the corticosteroids, which I think is the hormonal pathway that underpins psychosis. So babies, you know, if things haven't gone well right at the beginning, they're really primed with SORA in that very underfunction situation, you know, and we have to right that if we can. It's not easy, but, you know, was it 1 in 50 now are on the spectrum? You know, they're not getting such a good start in life, and we can work with them, mothers, when they're pregnant, and get the really little ones. It's very important, you know, for going forward, for having good health.
Yes, it's like we said in the interview, Ramisami, the treatment of the child starts after conception.
Yeah, right from the day of conception, the treatment of the child starts there. If it's in the womb. So a pregnant lady, if she starts taking homeo medicines, I hope it will be further better for a healthy child. And mostly the constitutional medicine for the mother, if given during that stage, I think that is an anti-miasmatic drug, I suppose, medicine, I suppose. That would hold good if it is prescribed during that stage. And I have a thing like that. Many of the suppressed, any suppressed symptoms, they come up during pregnancy. They get flared up during pregnancy, and that is one concept that keeps going. And as we all know, whatever the pregnant mother is getting exposed to, either it may be a physical or or a trauma in the emotional plane, it is all going to affect the growth of the fetus inside, and it is going to bring about changes in the mindset, not only in the physical, in the developmental arena. Everything is going to bring about changes in that place. And so it will be ideal to start if the pregnant lady comes out and starts for any of the ailment during a pregnancy, not just like that. Any of the ailments that we commonly encounter, it may be even just for her. What is that? To tell for the any immediate morning sickness, if it is an overwhelming hyperemesis factor to start with, if she takes on a treatment with homeopathy, or it may be for the varicose veins that occur during pregnancy, if it takes a painful stage, if she takes homeopathy, or even for any itching or any skin complaint that happens during pregnancy, or for any fear, any kind of threatened abortion is there out of fear or something like that. If there is a chance of taking homeopathy, it would be better. And mentally, developmentally very strong babies you can expect if the child is, if the fetus is treated when it's in the mother's womb. And I have that kind of a mother taking treatment even during pregnancy for some other ailment, but you can see that what has been running through generations, like a bronchial asthma that is running from the grandfather suffering from bronchial asthma, then the father suffering from bronchial asthma, and on the maternal side also, we had one of the parent suffering from bronchial asthma, same, some kind of allergic bronchitis. The mother was taking treatment, the pregnant lady was taking treatment for some minor ailments, not, she was very healthy, but she had an occasional sinusitis occurring then and there, and she used to take the treatment for that. And comparatively, the child that was born to her, now the child is about 8 years of age, and from birth the child is pretty good, not even prone to any major respiratory complaints or any other major viral infections or whatever may be the cause of infections. He has not been succumbed to, he has not been to any kind of illnesses. What other children in your classroom, a nearby person may be having a severe rhinitis or something like that, even on a very huge exposure to an infected person nearby, this person has remained strong. And even though he has a long history of this allergic rhinitis running through generations, this child who's of 8 years of age now, he is comparatively better. He's better, he is not prone to any kind of respiratory infections, hale and healthy. He's an athlete, actually, he's an athlete, which the family has never been dreamt of, because they were being they were generations before they had been suffering from respiratory complaints, so they don't even have the intention of taking on to running, going to the ground, or getting exposed to any harsh weather. But this kid is not like that. He's into sport. He can withstand extremes of weather, both hot or cold. That is one minor example. I could say that if the if there is consumption of homeopathic medicines for even for the minor ailments that is taken during the pregnant stage, it could bring about a reduction in the ailments that is passed through generations and generations. It can pull on, it can put a halt to that point.
I think too, even before conception, especially in a tubercular miasm preponderance, it's very important for both the mother and the father to be on folinic acid for at least 3 months before they have a conception. We get a lot of midline abnormalities in Australia of the palate and lip and tongue tie, which then of course makes breastfeeding really difficult. So, getting the health of the mother through nutrition and supplements, as well as homeopathy, I think is really important. and lots of zinc, because zinc is stored in the gonads. So healthy testes and healthy ovaries depend on lots of zinc in the diet. And there's been some really interesting research about the moment of conception and a spark of zinc that will come from the egg in a healthy conceptus. So, you know, mothers who are low in zinc are often the ones who get the bad morning sickness too. So, you know, they might need the sepia, but, you know, there are a lot of other factors at play here.
Mm. Yes, I was just thinking about that. The preconception is so, when I say that to people, you know, that fine giving up alcohol and smoking and eating well when you get pregnant, but when you think about it, eggs and sperm are produced before conception, and they go, oh yeah.
Yeah, well, the eggs are there right from, you know, when the woman was conceived, but of course the man, it's about 120 days, so, you know, it's very important for the males. But even after, you know, even after birth, I mean, women forget that they're still growing their babies. I mean, babies are born at 9 months because they wouldn't be able to, you know, fit through the birth canal if they were left there any longer. But, you know, they're not done till they're about 4. And that's why, you know, going to the breast, it takes over the job of the placenta. And to eat well is even more important after the birth, and people forget that, you know, and the women come in and they're sepia and their hair's falling out and they're blur, and you just look at their diet and it's abysmal. And you have to start saying, okay, you're getting enough protein, you know. Let's have a look at the diet. It's very important.
Do you face the same problem in India?
Actually, yes, there is a nutritional supplement that program runs as a national program as such, nutrition for the pregnant ladies, and not homeopathy into that. Actually, the national program is not for homeopathy. So it's been like supplements right from the conception till the lady delivers the baby. That program is running there. And that's how it keeps going. They have a separate antenatal clinics and postnatal. Everything is properly channelized out there, and the nutrition status of the mother is checked out, and she has been giving supplements, and routine checkups and visits to the hospital is maintained. It is maintained with the dais, everybody around there, and it happens like that. And I feel the awareness to consume a pretty good nutritious food and is much more than what was seen earlier. And death at the time of labor is the prevalence of that is the incidence of death, the death rate, maternal mortality rate has actually decreased because of this frequent antenatal visits and this proper nutrition guidance, everything like that. And it has been on the decline. But homeopathy is not there in that program. It is only because if the person, out of interest, out of their own personal interest, if they take on homeopathy at the pregnancy, I mean during pregnant, that is in the antenatal stage, or postnatally, that is its own personal will and wish. And that program, the homeopath is not channelized into.
But now if we see the baby is born and first thing that happens, poor baby gets vaccine. And not only one vaccine, mostly triple or even more. And we, at least in Germany and Austria, we did see a rise in autism. These people do that.
Gee, it's interesting. There's a bit of discussion over here that the peanut allergies that we're seeing a lot of, well, we do in Australia, and I'm assuming it's everywhere else, that sesame oil is an adjuvant in the Hep B vaccine. And this is the primary initiator of that in susceptible individuals. You know, if they could make vaccines that had safe adjuvants, it would make a big difference, I think.
Yes, but as long as they're taking mercury and sesame oil and all things in there, you will face trouble.
Yeah.
I thought they'd been removed in a lot of them.
Yes, but not all of them.
Not all of them, no.
No, the flu vaccine still got Thimerosal.
Mm.
Yeah. And they're promoting that for children now too. So,
Mm.
I mean, the schedule now is like 50 shots or something before the age of 5. It's.
I think in America, I think it's more actually. I read somewhere, I can't remember. Maybe not shots, but diseases, because some of them are mixed.
Yeah. Yeah.
Mm. But I happened to find homeopathy through my first child, and he had some really quite serious digestive issues. I won't go into details about it now. And I tried, I went to the doctors, and it was, drink water. He was only drinking water basically, and we had a very healthy diet. He was about 18 months, and then it was prune juice, all that. Nothing shifted, and then after about 6 months, they said that they gave me some anesthetic cream to use for him because it was so painful. And I thought, this is not making any sense. And I'd never heard about homeopathy before. And then my friend who had lived in Switzerland and used homeopathy, she said, I think you should try this. This homeopath has just come to our area, and I think you should try it. And she literally sorted the problem out within the next day. He was fine. And up until he left home when he was about 18, after that I actually continued, because he had the problem as well was that he had like constant ear infection, tonsillitis, conjunctivitis. It was just kind of gunk, and he had been on a number of courses of antibiotics, I think 3 or 4 courses of antibiotics in that first year. And then he was given this remedy, and it just changed. And I just sometimes think, what if I hadn't tried? He would have been like me, because I was very ill when I was little. I was an ear child, so I had antibiotics constantly up until I was about 4 or 5, which then produced a lot of other problems. And then so up until he left home when he was 18, he had only been ill twice, and then very high fevers for about 3 weeks when he was in year 6 and 3 weeks when he was in year 9. But apart from that, extremely healthy. And then he had a few years where he wasn't so healthy, and I said, what are you eating? Because he left home, and and then he realized, I need to eat well as well, and which he's doing that. And
I came to homeopathy because my middle child, my daughter, she was vaccine damaged. So I took her to a homeopath, and then I ended up having a small job in that clinic, and then I decided to study it. So it's interesting how our journey in life changes.
Yeah,
I used to be a high school teacher. Yeah,
that's what I decided. That's the reason I decided to become a homeopath as well.
We have a question from a listener in the chat. She asked whether one of you has experience in cases where vaccinated babies have a swelling of the brain.
Sorry, they have what was
the brain after vaccination?
I can't hear the word you say before the brain.
Swelling.
Swelling. Okay, no, cut out.
Does they mean meningitis? Meningitis, I hope. Or if that is what they mean.
Yeah. No, I just didn't hear the word. I don't actually.
I mean, I've treated autistic children who've reacted badly, and they've had a lot of mental symptoms, but whether you could say it was swelling of the brain, I don't know. But I mean, how is that diagnosis of swelling of the brain derived, and how quickly after vaccine do we have that diagnosis? So, I mean, you just go with acute reactions. If someone came to you, you might be giving belladonna or something it would really depend on how the child presented.
I remember a case of Yorgos Vitouras who presented little baby with meningitis, and nobody could help. Conventional doctors gave it up. This is one of the really nice cases of Yorgos, where he said, "Don't you see it? Just look at the eyes." It's Ignatius, because he could observe it. He did see the child was so sad, baby, and was cured in an instant.
Amazing.
It's all about observation, and you have to have the experience.
One thing I learned from Robin Murphy when he was in Australia when I was a student, that's a long time ago, and I've always used it in my practice for people who want to vaccinate, or in Australia, you have to vaccinate if you want to get the family allowance from the government. So for some people, they don't have a choice if it comes down to money, is to give Ledum the day before and the day of the vaccination. And so what that does is mitigate against the adjuvants that are in the vaccine. And I find that it actually works quite well as a first protection, if you like. And then, of course, if there are reactions, you go in afterwards. But to give Ledum prophylactically does help.
Yeah, I've used that as well.
But it says that we look at the vaccine and the adjuvants as some kind of poison, just like a scorpio, a centipede, or any other bad thing that could bite you, and you would take Ledum for that.
Yeah, they're toxic. Yeah.
This is what it says in reality. Oh, now comes the next comment. She said that the diagnosis of swelling of the brain came from the pathologist, so after baby step. Not so nice.
I've not seen a case, not an acute one.
No.
Did
Not
you?
this acute meningitis, but post-vaccination, it's only just a mild fever or a rash or something like that. And I have experience with pyrogen to a lot of cases. Pyrogen 1M in water dose to this post-vaccination fever, belladonna, both belladonna as well as to this pyrogen 1M. Not to this kind of meningitis or something like that. I have not seen to the swelling of brain as it is given, not that kind of cases. This is what we normally in India, there is a definite national immunization program. So many shots, even they reach by the end of 1 year itself, they would have received a lot of vaccines to their hold, and MMR. We have lot, polio, everything goes in, and now we have even typhoid vaccine, hepatitis. Of course, everything is going on and on. And most people, they resort immediately to any fever or something like that. They resort what is easily available to them at that moment, because over-the-counter medication is very easy here in India. Even without a prescription, it's very easy out here. So, and for normal fever and all, it would be resorting to small medications like paracetamol, they go for. One who has been constantly taking treatment in this alternative system, that is our homeopathy, they would resort, even though we don't like to vaccinate, it is under the national program. So it is compulsory for the children to be vaccinated. So there is no way to escape, or it is beyond their means to avoid vaccination. So only for the post-vaccination effects, if they have been continuously taking on to homeopathy, it may be a mild swelling in that particular area, or fever, as I said, as I was talking about, and nothing more than that. We can contribute directly as related to this particular vaccine. They have developed this, that, nothing like that.
Sometimes too, giving babies some extra vitamin C before the vaccine does help. with reactions. It's no good the mother actually taking it if she's breastfeeding. It's interesting because vitamin C is one of the vitamins that the breast kind of is selective about. I mean, your mother can take lots and lots of vitamin C, but it won't go up in her milk very much. So you really got to give it to the baby. And liposomal, you know, just getting the one that's in the liquid is probably the best form to give it.
Mm.
But yes, what we try with that is just make the damage a bit less.
Mm. Mm.
And I
Yeah,
think
so
what
we
we
can
are
do.
doing to the little children by this compulsory vaccination, by somehow on purpose damaging them, and then we need to somehow repair and try to get the best out of it to give them a proper life. Or what Elizabeth has to cope with. Babies get infections, tonsillitis, otitis, conjunctivitis, what is very often. And in her country, those babies will be fed up with antibiotics up to here,
Mm.
so they finally can meet Elizabeth at age of 8.
I think you might find that some of them have got practitioners outside the country and they're being consulted online because you can get access to medicines easily enough. So,
but that actually, it's
illegal.
Well, I'm not sure it is actually, but it's the problem is sometimes speaking for some parents to speak English to be able to say what it is they want. You know, they might not be able to convey what it is they want to say.
Yeah.
And I was going back to the vaccine. I suppose the people who vaccinate don't think they damage the children. They think that they are actually doing a good thing. That's the thing.
Isaac Golden did a seminar here just a few weeks ago, and he said that they've done a survey in Australia, and it's nearly 80% of parents are happy to vaccinate their children. You know, they feel secure in that they feel that it's safe. So, you know, that's what we're up against. So
they feel they're giving a protection to their children by means of getting vaccinated.
Yeah.
Feel secure. Something. It's like like a guard. What's a protecting guard in front of them as if they are vaccinated. Because you see now everybody are waiting for COVID-19 vaccine to protect themselves from COVID-19. So vaccine
it's really hard for modern families because mothers often are in the workforce and, you know, they have to get their children into care very young. They can't breastfeed for, you know, extended times, or it's not easy for them. And so they really feel that if they get them vaccinated, you know, they're giving them protection. So, you know, you can see the way their mind is thinking. But, you know, I don't know that it's necessarily the best option.
Yes, and in other countries, you can't enter the kindergarten without vaccination. You're just not allowed to bring the child there. Even schools nowadays.
Even
but I think
travel restrictions also. Travel restrictions also, if you've not been vaccinated for hepatitis and there is a travel overseas travel restrictions are there. So you cannot go to have a travel if you're not being vaccinated for hepatitis, something like that. So it's there. You cannot get admission into school. You cannot travel. So every ban is out there. Then they cannot lead a normal life if they aren't vaccinated.
Interesting where we got in our society.
But I think also it's worth mentioning because being concerned about vaccines is viewed as being sort of slightly crazy, slightly out of it. I would say, you know, most people who are concerned about vaccines are concerned about it because they had an experience that made them concerned. Something happened that made them concerned. I had no idea. I remember going in to have my son vaccinated thinking, this doesn't feel right, but I didn't know that I had the right not to do it. I did actually have the right not to do it, but I didn't know that. And then he had been so quiet up until then, really calm, really. And after that, he was just screaming all the time and really not very well. I still continued because I didn't twig. But I think that's what happens, is that you have an experience that make you look into what is this, and and that's how it starts. For most people, it's not just something you wake up in the morning and think, right, I'm going to be against vaccination, I'm going to look into vaccinations. You don't do it until something happens.
I had very, very bad experience concerning that. I was vaccinating calves, now the cows. And when I was vaccinating the 20th in the row, the first 5 collapsed. One after the other collapsed within 1 hour.
Wow.
That was my entry as a young vet into vaccination. And then I started exploring, thinking, learning more and more about the immune system. And then I got back to university talking to my old professor and asking him what happened here and what he would think and what he would say. And then he took me in his office. He said, shut the door. Nobody needs to do this. And then he told me about naturopathic things I could do to suppress the effects of vaccination so that this does not happen anymore. So this great, great, great professor in microbiology and immunology, he himself did not believe in a positive effect of vaccination. And he knew about the problems.
But why do we have to have the conversation in private? Why can't it be accepted that, okay, if you have a reaction, here's a solution?
And also, I think it's quite interesting what actually can be done with homeopathy when there has been a reaction. And I think that's more than talking about the bad effects. I think that's what we need to talk about. What can you actually do? I think that's quite important.
Yeah. And, and I've fixed, children who can't walk after vaccines or have a lump at the site and, lots of little things, and they respond really quickly to remedies.
Patricia, do you want to talk about a case that responded good?
Well, oh gosh, they're so old. I can't remember everything about them. I just know that in the past I have treated such things. People come in and it's just, and sometimes you just see them for that. They just come in and you give that remedy and fix that, and you never see them again, which is a shame. Anyway, it's the way it is.
Masami, do you have an interesting case of damage after vaccination?
Damage after vaccination, as I heard you, as I was talking about it, it's not specific to any particular disease like meningitis or something. It is only for very minor ailments, I could say that. Only for a case of fever, or it could be like a swelling in the area, in that particular area. But one case, not one case, but a lot of cases around a lot of persons, children around the age of 8 to 12, I see a surge in the case of complaints of abdominal pain, and whose ultrasonography reports show that they had mesenteric lymphadenitis, and this pain, it mimics that of acute appendicitis. So this is what I've observed during these years. So this for the, I think not for the past for few years, right, from about 15 to 16 years, there has been more number of cases that we see with a diagnosis. I mean, ultrasonographically, we see the report as mesenteric lymphadenitis, and they have a very severe pain in their right iliac fossa, which makes them to excruciating pain, sometimes attended with nausea, vomiting, and even fever. So we obviously say confuse it, or we have another diagnosis is acute appendicitis. So we know that if it is a case of acute appendicitis, they have to get it removed immediately. So otherwise, it may lead to peritonitis. So we just send them. Just it would be for the pain relief. It would only resemble belladonna or Colossus at that time. It will only resemble, we can take on a picture of belladonna or only Colossus, and that would have definitely relieved the pain. In almost all cases, I have in between these two remedies, I had got the pain, that abdominal colic getting relieved, and when it was diagnosed with mesenteric lymphadenitis, I remember a few of the cases. I would a specific remedy as Iris Tinax. That is one remedy that was good, but I would again find that tuberculinum prescribed as an intercurrent in those cases. They were very resorting to a normal stage where their ultrasonography reports showed a completely normal abdomen without any lymph node getting swollen there. That was that tuberculinum, the relief from tuberculinum, what they get as the relief from tuberculinum, made me, made me to have a doubt that why not this be related to the BCG vaccination? Why maybe this is fine. This is one thought of mine that because we see a lot of children getting this mesenteric lymphadenitis, and why not be the vaccination may be a reason for that. And this idea, why I got this was, they are most of the cases responding well to tuberculinum. So I got this as I had this idea script into my mind, and I feel maybe it might have a relation with the as a vaccination effect, the children developing into that kind of conditions. So this is what my observation, or this is what my what is the cases that I've seen all through these years. So this mesenteric lymphadenitis getting acutely relieved with belladonna or Colosynth, and few of the cases getting relieved with Iris Tinax, and for a complete cure, and in most of the cases responding well to tuberculinum. That is what I have found in my practice.
We get a lot of behavioural problems in children who have been much vaccinated. And I've had a few cases over the years where, interestingly, Mercurius has been the remedy, you know, and of course Mercury is an adjuvant in a lot of the vaccines, and you can kind of make that link if you like. And a lot of children too who young present as carcinosin, I find it's an ailments from vaccination. They're children who have big behavioural problems, and that's always a long, slow road to getting them well. And I would use bowel nosodes along with that. I find Morgan Pure is a really good bowel nosode to use in the cancer miasm picture. Interestingly, Morgan Pure has all of the main nosodes in it, tuberculinum, syphilinum, serinum, so I find it goes well with carcinosin, particularly if it's an MMR aggravation, because all that work that Wakefield did, you know, it does affect the gut, and you have to go back and sort it out.
Again, we are resorting to a whole array of nosodes in the treatment of post-vaccination effects.
And in Sweden, nosodes, there are no, all remedies in Sweden have to be registered, and it's a rather expensive process. But also nosodes, we're not allowed to use nosodes.
Yeah.
Not even in high potency. No nosodes.
No, not at all. They're not registered. They're not. They can't be registered here.
Yes, it's getting to be a problem, you know, bodily emanations being turned into medicines. It's becoming a bit of an issue. I don't know any of you saw my case in H-pathy back in April. I published a case in H-pathy, and it was a family I treat, and long story short, but a woman had had twins really, really early, like 32 weeks, and one of them had a really bad time with her gut. And we tried a lot of things. She had all the normal worm remedies and she wasn't responding. And the mother had another baby. And she had some colostrum in the freezer. So I got her to give it to this child to go back because she had missed out because the mother had been in the NICU herself for 3 days before, the babies didn't get colostrum. And then I also made a nosode from that older baby's nappy. From the stool and made a sarcode, which we gave to the older child, and it really went in and fixed her. And the mother also made a remedy from her breast milk. So that's kind of keeping it in the family. And using your head. If you can't get the medicines, it's amazing what you can do. Interesting case that. It's on H-Pathy back in
I will look it up.
It's called Keeping It in the Family.
Okay.
The mystery of the microbiome. Big mystery.
It's more important than I think we ever give it credence to, which is, why being born vaginally to start with, and then, being put on mum's tummy and then going to the breast, all those little steps, is just to get all those right bugs, all those familial bugs in Bubby's system is so important.
But also in mainstream or allopathic medicine now, they do these they put back stool samples of various people, and I think
fecal transplants.
It's much more pleasant to take a little homeopathic remedy with it rather than doing that.
Yeah, but still, when you think of conventional medicine and children getting conventional medicine young age, what we do is destroy the microbiome. Definitely. And to repair the microbiome is not that easy.
No. See, that's why Lacumanum is such an important remedy, because it does help to go back and correct some of that, especially when you use it in low potency. You've got to remember the lacs are sarcodes. And, if you're going to use 7C, it can go back and repair a lot of that damage. And I've published lots of cases on that over the years. And I encourage mothers to make a medicine from their own breast milk as they're weaning, so that they have that in a 7C to give the child and the toddler if there are ongoing issues with the gut. And you can, it's easy to do. It's on my website. It's just need a few bottles and some methanol and a few drops of milk and off you go.
Oh, you do it, you don't do it as grounding, you do it from the start as...
Just get 33 drops, I think I say, get it. And I've got a little formula there that I just made up. And it works really well. Just knock it up to 7C, and then that your mother has got that stock, and she can give it to the child. If it's, I usually say give it in the toddler years, new moon, full moon, till they're about 4, just as an ongoing sustaining thing to give that energy.
Interesting.
Another thing we really don't look at in conventional medicine is the moon.
Big in children. I mean, gosh, you little carbs who aggravate at the full moon. It's just like, and I often say to mums if they ring and they have it, I say, well, it's the full moon, just give it a few days. Especially if they've had calcarb or they've had silica, it'll usually settle.
But I think for homeopathy for children, for all the, if you don't look at all these major serious things like vaccine damage and everything, for the colds and the coughs and ear infections and the digestive issues, and it's just amazing how, I know I've treated lots of children in London who came in, monthly tonsillitis, antibiotics many times. And just within maybe 1 or 2 appointments, it's actually all it takes to clear that susceptibility. I have actually treated a child. She was over 8, but she came to me. The mother brought her. She had been on antibiotics literally every month for tonsillitis. She was going to a special child pediatrician doctor. I can feel my English sometimes goes when I've been talking about it in Swedish, and I have to think about what it's called in English. And she came, and I gave her just some, when I was doing my sort of more practical homeopathy, so I gave her Nux and sulfur to clear out the antibiotics for 1 month, and then she had silica. And this was about at least 6-7 years ago, and I heard from the mother, I think it was last year, and she's still not had any tonsillitis.
Yeah.
And I think she had flu once, but she was fine. And also what happened when the impact of having tonsillitis that often and being off school so much means that you're missing school, friends, activities. The one parent has to stay home from work. It affects so much. And then within literally 2 appointments, it's cleared. It's not always like that, obviously, but quite often I think with these, I would call them subacutes, because they are acute, but if they keep coming back, they're obviously chronic. But they are quite fairly simple, usually.
It's going to be interesting going forward now with the children all around the world who've missed so much school this year because of COVID, whether this is going to have some long-term impacts on them for socialising and learning. So we've yet to see what will come from all of that.
Although I think I've heard lots of reports of children not being anxious, and they have learned so much because they haven't been anxious. There is different aspects to that.
Yeah, a lot of people are homeschooling more now, which I think is lovely. But in Australia, I know a lot of parents have been working from home as well. And if they've had the children working, doing school, it's been a real strain for the parents to continue doing their work and trying to supervise the children. And it's been a bit of a nightmare, actually.
And of course, in Sweden, all the schools have been open. So they only closed the colleges and the unis because they were worried about too many people on the buses.
Yeah,
I think was the main reason.
Yeah.
Ramasamy, you wanted to say something?
Just I was agreeing to their statement. It's a burden, double burden to their parents. Because they're staying both working from home as well as taking care of their children with their online classes. So here in India, it's an online classes are going on. So parents have the burden of looking into their work as well as their even attending classes along with their children. Because most of the younger children, they need a parental support during the classes also. It's as though all their homeworks are needed to be done it's to be retaught. The parents now take the role of teachers as well. That is happening. Because
and they need to be able to play, and they've not been doing their school sport and all of those sorts of things. It's, and the grade 12s can't have their school formal. I mean, that's such a rite of passage. There's lots of important things that, have had to be put aside, which is a real shame. And I think it's going to have consequences.
Yes. You don't have the playground activity also. They miss that peer relationship. It's only that is definitely going to have an adverse effect this year, in the coming years.
Yeah.
They cannot adapt to and another one, social environment. The adaptation challenges are to be met with in the near future.
And I wanted to say, especially in those countries where the children were confined to the house.
So your sound's waning.
Didn't catch that.
Your sound, we couldn't hear what you said.
It goes down.
Sound's going.
I said that especially for those children who were confined to the house and couldn't go outside, couldn't play. This was absolutely tragic. Living in high buildings, in flats, not being able to go outside. And I wonder whether we are creating here a trauma layer, wearing the masks, confining kids to the house, doing social distancing, still keep them learning, still keep them under stress. And I think, are we producing a trauma layer and bird remedies?
We will find out. We won't know.
We will. Watch this space.
Yeah.
Like a chicken in the cage.
Mm.
Still having to perform and no freedom anymore.
But I actually think some of these children have found the freedom in not having to go to school. Actually, I think it's both, and obviously that depends completely on your family situation. If you are in a family with abuse and obviously all sorts of things, no, maybe not even enough money to buy food, that's the problem. But I do think that quite a lot of children, my understanding is that quite a lot of children have, or a lot of families have actually found some kind of freedom in this.
We've got an interesting situation here with the boarding schools. Children have not been able to travel home for holidays. And if they do, then they come back, they have to be forced into isolation for 2 weeks before they can join their class. Some of the rules are crazy.
Mm.
You know, it's just not fair. These are families.
I've been talking to people in Kenya. They face the problem that the children have to go back to the families, to the villages where there is no food, where there is abuse, and the schools won't open till January or later. They face a lot of trouble. They're doing initiatives like Teacher on Bicycles, just give the children a bit of hope. Especially Uganda, great problem. We don't know it because no newspaper speak about that, about those tragedies, side effects of the lockdown. So, does anybody want to tell us a special case about children and homeopathy, an uplifting case to the end of our talk?
I had a very interesting case years ago, which I did publish in England, of a 3-year-old who came into my clinic with a cough, and the parents were wondered if she had whooping cough. It was quite a harsh cough. She was wearing the amber beads that you wear when you're teething. And the mother was also wearing amber beads, which was interesting. This is, this observing business coming in. And the child was still being breastfed. And she came in, she was a little bit shy. And then she hopped off her mother's lap and she went over to play. I have a lot of wooden toys, puzzles and things. And she went and got the trucks, which I thought was a bit interesting for a girl, because I have, prams and dolls and blocks and other things, but she took the trucks and she was playing with the trucks. And so I commented on it. And her father said, oh, she loves trucks and engines and anything that makes a noise. He says she gets so excited when we go to watch the trains go by and they blow their whistles. And I thought, fear of trains, I better look that up. So I did. And I noticed that Succinum was one of the remedies. And when I was doing that, she hopped on and she was having a breastfeed. And so I said to the mother, I said, why are you still got the beads on? She's obviously past teething. She said, oh, she likes to wear them. And I like to wear them too. And the child reached up and grabbed her mother's beads. And I thought, so I talked to them and I said, I really think you're doing approving of the beads. And I think it would be a good idea if you remove them. And so she took the beads off the child. She took the beads off herself. And I gave Succinum. Cough was gone in 2 days. No problem. And so I published that case because I think that, wearing those beads, during the time of teething is probably fine, but having them on 24/7 for several years, I don't think is such a good idea.
Yes, to think of Peter Tobinello and his new repertory about gems. Gems have effects. and they
Yeah.
have their symptoms improving.
Yeah, there are times when I can't wear certain jewelry, you know, because I react to it. Yeah.
Yeah, this is an interesting thing we have to talk about and think about.
Mm.
An interesting case you want to talk about, Elizabeth?
I'm just trying to think, because I think it's one thing that I think is quite interesting, especially with behavior problems in children who have displayed behavioral problems from the beginning, is that you need to look at what was going on in the mother and maybe the father and what was going on behind. One particular case that it's not actually 3 years later, still not fully resolved, but there was one child who had doing gestures and tics. It's not exactly behavioral problems, but having, you know, it's obviously trying to calm himself down, doing something. And I did the consultation, and as the mother left, I think we didn't really talk, for some reason it didn't really come up in consultation, but then she said that she had such bad migraines that she had taken a lot of migraine tablets and headache pills during the consultation. And again, I just started off with Nux and sulfur to try and clear some of the effects of the toxins. And after 4 weeks, he might have been 5% better, something like that, 5%, 10% better. And then she'd booked another call about 10 days later, something like that, maybe 2 weeks later after the consultation, you know, I always say to people, you know, you can book a 15-minute free consultation if you want, if you have just a question or something's happened. And she rang and she said, I just have to tell you, he's 90% better. And then it's gone up and down. So you know, we still haven't got to the core of it, because it, you know, sometimes it's much better and then it goes back, sometimes back. So but basically they were told by the child psychologist that he's just going to have to learn to live with it. And I think it's quite hard to live with these kind of things, because, you know, it's quite obvious that you're not as everybody else. And I have noticed lately that there are a lot of people, young people, with doing gestures or the tics or whatever we like to call them, but, you know, having to do something or you know, do something with a leg. I was in a shop yesterday and I saw two people, not same family, two different young people doing it, and I'm just thinking that there is a lot that we can do quite simply to clear, you know, that there's the toxic layer somehow that you can clear. And quite often it's almost like, I always look at it, it's like you got stuck. And then just to make things flow much easier.
Talking about stuck, you know, I was just thinking, you know, Sankaran and Anacardiaceae. I had this really interesting case a long time ago of a woman. It was her fourth baby, pregnancy, home birth, a very healthy baby, breastfed. And I used to see the mother in the pregnancy, and she used to talk to me about her feeling about the baby in a past life. And she said, I'm very protective of this baby. She said, I have a feeling that in the last lifetime, he was killed in war, and he was shot in the head and lost half of his face. And so, you know, we're having the home birth, and she didn't take the baby out of the house for 40 days. And there was a healthy baby, breastfed. So I didn't see her till she was 9 months. She had a little girl. And when she brought her into the clinic, it was because she was crawling with a limp. So the cross pattern, but she was hitching one of the hips. And I took the case, and it was Rustox, and I gave Rustox. And within a few weeks, she got a shingles all on the side of the face that had been shot away in the previous life. And of course, Tina Smith says, you know, Rustox is for past life trauma, which was really fascinating. So anyway, we gave more Rustox, and then she was finally resolved with China. because it was a malarial situation. But I thought that was really a fascinating case. Fascinating.
That is fascinating. Past life trauma.
Mm.
And so interesting with the rash on the face and half of the face.
Yeah, just where the mother had said had been blown away in the previous life. Yeah, interesting.
I have one interesting case of ADHD, attention deficit hyperactive disorder. A boy aged about 13, there is a teenage boy who was actually diagnosed, a diagnosed case of ADHD. Came into my clinic. He was coming along with his mother and father. The As soon as he entered, not entered actually, I should say, so not softly, he slammed open the door, literally jumped into my chair, took my steps, he put it in his ears and tried to auscultate me. That was what he was trying to do. He was just taking a hold of my place. That is to say, he was invading my personal space. He wanted to sit on the chair on my side. He was trying to sit, and he was smiling, always smiling, not shown any kind of more aggressive mode on his face. And then he jumped onto the examination table. He sat there. Then he was taking a whole, looking into the medicines. I had my cupboard, medicine cupboard behind the table. So he was trying to take out very fastly. He wanted to take out, and he made a huge mess of that particular area to my consultation room. And so I started because it seems to be like tarantula. I initially started with tarantula, and he was improving for a long time with tarantula. But you know that it is always a mixed bag. ADHD is a mixed bag. For they'll not be able to resort to a particular task for a more amount of time. Their tasks should be broken into fragments. Their span of attention is very limited, so they have to be kept on changing the task assigned to them. So the thing was that when he was able to sit on for about only 10 minutes for a particular task, after taking on to this course of tarantula, eventually he was able to focus for 30 minutes a task. He was improving in that way, and he was only able to do this kind of machinery work. He was more focused on repairing things or something like that. That was his interest. So it kept going like that for a long time with tarantula, and followed with carcinosin, and he went on to a training school with a diploma course in mechanical engineering, so something like that.
Wow.
So I was very happy with that regard to that case. So that was the improvement I could see with the ADHD. One fine case which responded very nicely. And recently, a case of ASD. Recently, a case of ASD, diagnosed case of ASD, who looks only to the revolving objects. He was interested only into the objects that were moving. If he sees a fan, or if he sees a wheel, a bicycle wheel or something like that, he'll be fascinated by that. And what the thing from the mother was that she wasn't able to understand that ASD is a neurodevelopmental disease. She was from the IT field, a well educated and engineering graduate. At the same time, she wasn't able to accept the fact that such a child has to be continuously taken care of. Every step of the child, every stage, every day has to be taken care of very closely by the parents, and you cannot expect the results to be out in 15 days or 1 week or 1 month or something like that. They want the mother wanted, when will my child get back to normal school? He's of the age of 3 years. When will my child get back to normal school? I want my child to get enrolled in normal school. So the basic thought should be that it is a developmental disease. It has to be followed continuously. It has to be followed continuously to make them fit into a normal stage of life. It's very quite difficult. They have to be trained continuously. Even though we are prescribing them medicines, they have to be trained continuously. The basic concept.
Time.
Now it takes a long time. So the parents had to be very patient enough to not only handle these children, but at the same time to observe the positive effects of homeopathic treatment. We cannot expect a miracle to happen overnight with regard to these developmental diseases. That is what I could share as a word in treatment of pediatric cases, especially developmental diseases with homeopathy. So this is.
I had an interesting case a few years ago of birth trauma that resulted in a child with ADD, and she really struggled at school. She had trouble learning, and that mother had a subsequent child, and when she brought the girl to me, she was breastfeeding a new baby, and I did make black humanum from her milk, which did help. But because there'd been trauma at her birth, she needed lac maternum, as it turned out, to really finish it. And the interesting thing about lac maternum is that it is a remedy, as Tina Smith said about incarnation. She wasn't properly incarnated. There was birth trauma, cord round the neck. And she sat on the consultation table. And one of the things about lac maternum is that they are able to see into the future and see into the past. And she sat there and she was telling me about a dream she'd had. And she said, I dreamt about when Mummy was a little girl and she was talking to her mum. And she recorded a conversation that actually had happened. The mother was sitting there and she said, this is the power of what our remedies can access. And the lac maternum actually dealt with that layer. And I think Metarainum finished the case. But it took 3 years for her to be able to say that she didn't need a tutor at school and she could read properly and do her maths. It was a slow progress. So sometimes people expect us to do things, wave a magic wand and it's a miracle, but it's not that easy.
Sometimes it takes time, especially in those neurological cases.
Yeah.
I remember a cat that was paralyzed after an accident. It took half a year of hypericum in LN potencies, but then it walked again.
Yeah.
And
I say to parents, it's a bit like you have a Ming vase, and you break it, but you've got to kind of glue it back together, and it's not as perfect as it was, but you can fix things, but it's an intricate kind of process and takes time. Yeah.
But it's interesting with birth trauma as well. I had a patient who always felt very hurried. She was over 40, or maybe actually at that point I think she was 39. Always felt like this real hurry, lots of different things. And she came to me, I can't actually even remember what she came for now, but I thought I'll go back to that. And she had a very, very traumatic birth. And I thought I go back and I just gave her some aconite high. And after that, she just actually calmed down.
Yeah. Big scratch in her record.
Yeah. Some things just don't get better when you don't touch the trauma layer. You have to start from there.
Yeah.
But it's interesting that, so many years later, you can still go back to something.
That was one of the really interesting things that I discovered when I did the proving of lac maternum, is that it really is a remedy for birth trauma. When you think about it, the kind of births that most babies in the developed world are having now are not good experiences. There's artificial oxytocin used, there's lots of drugs used, there's instruments used. and they just don't come into this earth plane and really embrace it. So, you know, you have to go back and fix that. Fix it. Yeah, that's why borax is a remedy that will often come up with newborns. You know, that fear of falling, you know, the incarnation process is about coming into a new life, a new body. It's interesting, one of the big dream symbols in Lac Maternum is the Ferris wheel. You come in from the bardo and you come down and around to come into a new incarnation. It's one of the symbols. And of course, with borax, it's that fear of falling. That's why they don't oxygenate well at birth. So when the baby comes out of the birth canal, opens the mouth, takes a big breath, the lungs fill with air, heart chambers change, you start to get pulmonary circulation. That all comes from that first breath. And it's interesting that boron is a trigger for the airbags in cars. You know, it's kind of, that connection is just quite amazing. You know, you just need that breath of life in order to embrace. You know, I'm sure that's when the vital force probably just really comes in at that process. And if they're not well oxygenated, you know, that's where you're going to get a lot of the candida and those sorts of things fulminating. One of the really interesting things about keynote for boron is that babies, I don't know whether it's like this in India, but in Australia, you know, the babies have the car seats and they have to be put backwards in the back seat. Is it like that in Europe? And so babies who are borax scream the whole time they're in the car seat because they feel that they're falling. It's one of the big keynotes for it. And you give the remedy and they're much more happy in the car seat.
Actually, borax is like, we have that babies are made to sleep in the cradle. So we say that when the baby is let down on the cradle, shriek. So it's fear of the downward motion. That is what we can
absolutely. Just put them down to change the nappy. And,
that is what.
That's one of the things you have to observe.
Sure. That shriek and the fear that comes up when the child is put to bed into the cradle, that leads you to borax.
Thank you for that nice.
I can't hear you.
Your voice is spinning.
You still can't hear me?
I can now.
Right now.
Can you hear me now?
Yeah.
Okay. So maybe the is confusing things. So what I wanted to say is we are reaching the end of our time. And I would like you to speak your last words, maybe give a bit of emphasis to the mothers to act right for their children.
And the fathers.
And the fathers too.
I'm in Sweden. I have to include the fathers.
Yes, so may I ask you for your last words? Who wants to start?
I'm not sure what it is that you want from us. I didn't quite catch it. You want us to give advice?
Just to summarize our talk and maybe address the people, our listeners, with some last sentences and topic that you want to stress most.
Well, I think just, you know, loving your baby is the most important thing, you know, mums and dads, lots of cuddles. If mums are breastfeeding, to try and breastfeed for as long as you can and get good support to make sure that that happens. And if you do wean, you know, make a remedy from your breast milk. That just gives a really good kick to the microbiome and a whole lot of other things as well. And that gives a really good foundation for health going forward.
Thank you.
I would like to say that I wish I had known about homeopathy much earlier, and how a lot of things that you think you need cortisone creams or antibiotics for can actually quite often be fairly easily resolved with homeopathy. Obviously in Sweden that's not going to happen. But I just find because it will help the child grow basically and be, you know, more. I'm sort of waffling on here a bit. I need to think about what I was going to say. No, but there are so many things that you don't need to resort to heavy medication for, basically. And maybe, you know, homeopathy, good nutrition, and exercise and everything. It's good.
Would be enough, definitely.
Pardon?
Would be enough.
Yeah.
Would be enough.
I mean, one of the things we're up against is that there is an expectation that things will get fixed properly quickly. And parents are often looking for a quick fix. And, you know, sometimes with a simpler kid, of course, but sometimes with more entrenched things, as we've said before, it is a process and you have to give it time. And then that's when some people are not that happy to stick the course, which is a shame.
I agree. And this is why I think if you start earlier, that's, you know, the earlier you start, I think that's what I was trying to say exactly that. You said it much better than I did. If you start earlier, the things don't get entrenched, and then you don't, you know, you're at a much better starting point. That's basically what I was trying to say.
Yeah.
Homeopathy is the concept of family physician. You can say that it is the word which we had long back, because we don't go to they don't go to specialists like this, that endocrinologist, neonatologist, then you have an ortho, you have a maybe gynec maybe there. But this concept of family physician can be best possible only with a homeopath, consulting a homeopath. And it is getting treated with homeopathy is it is similar to being on nature's lap. So how you feel comfort with a gentle breeze, with some drizzle and a mild sunshine. So that is the kind of energy or feel that we get when getting treated with homeopathy. It is a gentle medicine. And it's not like quick fix. It's not like that. And it would be advantageous if they could start in the beginning and not urge us towards the end stage. Everything is going to be settled, not at the end stage, rushing up at the end stage, but it is if in the tender age, if homeopathy is started with, if they initiate a homeopathic medication right in their tender years, they'll be a healthy human being all through their life. Very strong enough. We are based on developing their immunity, one's immunity, our medicines. So they'll be strong enough to fight all the rigorous bad influences from the environment, to fight back, to rejuvenate. That is what homeopathy provides. And I wish that not only mother, it's all for every people to take on a look into homeopathy, take on to the advantages of homeopathy, look at, see it as a medicine with a gentle touch, a healing touch, a gentle soothing, a dynamic medicine. Try to understand the paths of homeopathy and make them lead a very glorious and healthy life. That is what
and the healing is sustaining. You know, I always think it's wonderful if I don't see somebody for years, then they come back and they're just ready for their next medicine, you know, and you just think, okay, that's good.
Yeah.
We have the generation and generation of people coming to that. A mother is getting treated, she'll follow the patient with a daughter. We'll be seeing at least 3 generations in our lifetime, I suppose. That is there. So that kind of bonding as a family physician, like a family physician, you can meet out only with a homeopath. It is from the gentle treatment that could be seen from a homeopath who practices homeopathy.
What I actually wanted to say now was that listen when the body is whispering rather than waiting until it's shouting. I think that is really my message, what I was trying to say. It's just to keep, you know, do something when there are just small things going on rather than wait. And that applies to anybody, children or adults or anybody, because then they can quite often be resolved.
Don't
And of
go.
course, people come and say, oh, the remedy didn't do anything. And then you sort of go through it and that's fixed and that's fixed and that's fixed. And they just didn't even notice. And you just go, oh. Good.
Yeah, I know.
The gentle touch here.
Yeah.
Don't turn to homeopathy as a last resort.
No,
Yeah.
they do though.
Anymore. Take it as first resort.
Yeah.
This is what I say.
But our time is coming, I'm pretty sure. You know, I don't think Western medicine is going to come out smelling of roses after this COVID thing is done and dusted. So well, anyway, we'll see.
No, I've definitely noticed a surge in bookings actually, for maybe because people have time as well now, because they're at home more, that they can do the online. It's easier, but definitely a big surge.
Mm. Look after the immune system.
Yeah.
My dear colleagues, I thank you very much for this talk. I thank you very much for taking time today.
Thank you.
And I wish you a very nice summer.
Been enjoyable. Thank you. Nice to meet you, ladies.
Yeah, the same. I'm going to go read your article now.
Good.
It's nice joining with all three ladies. Bye-bye.